As scientists re-examined the trial data using a different approach than the FDA, they found what appeared to be a higher likelihood of potential side effects.
My name's Dr. Joseph Freeman. I'm an emergency physician and a clinical scientist. I specialize in harm-benefit analysis. Nearly all medical interventions also cause harm. So what we do typically with this is we try to compare them side by side. Do the benefits outweigh the harms, or do the harms outweigh the benefits?
Joseph Freeman and his colleagues conducted a reanalysis of the COVID vaccine trials, uncovering what appear to be risk signals associated with the mRNA vaccines.
In our reanalysis of the original clinical trial, we were shocked to learn that within the Pfizer trial, there were more serious adverse events in the vaccine group. There was 36% more, which amounts to 1 for every 555 people experienced an additional serious adverse event. And we found that the vaccines in the clinical trials themselves appeared to be at least 2 to 4 times more likely to cause a serious adverse event than to prevent hospitalization. This was clearly a very concerning finding, and we reported this, we published this, and we were able to get this done in a peer-reviewed study, and it has been heavily cited.
With billions vaccinated, millions reported health issues shortly after vaccination, including serious cases like blood clots, hospitalizations, and neurological symptoms. Many affected individuals now feel desperate, as regulators have ruled that nearly all cases are coincidental and not caused by the vaccine. Critics argue that the current system struggles to detect rare side effects and establish a clear link to the vaccine.
Our surveillance system really can only identify things like myocarditis. Our system can identify huge relative increases, like a 500% increase. Our surveillance system is unable to consistently identify harms that are happening at a 40%, 50% increase, which sounds terrible. And we have a serious problem if this vaccine is increasing heart attacks, strokes, or blood clots in the lungs, because they happen so commonly in the normal population, and they increase them just by even 20%. We are talking about tens of thousands, maybe hundreds of thousands, maybe millions of people who are going to experience these awful events unnecessarily, and our surveillance system will totally be unable to identify them.